Hello everyone! In this video, we will talk about neuromuscular electrical stimulation, or known as NMES, as an intervention for anterior cruciate ligament ACL. Hope you enjoy! ACL injury happens when there is a torn at the ACL, which is one of the two crossing ligaments attached at the knee. This ligament is responsible to control the knee during twisting or rotational movement and also prevents excessive forward movement of the shin on the thigh bone. Young people who engage in sports involving pivoting, decelerating, and jumping frequently experience this injury, as do athletes, particularly female athletes. People who sustain this injury frequently report intense pain, a popping sensation, a loss of range of motion, rapid swelling, and a sense of instability, especially in their knees. This injury will cause the sufferer to be unable to engage in sports, requiring cutting or turning due to this injury, and even simple tasks like walking will result in instability. After prolonged immobilization due to ACL injury, quadriceps femoris and hamstring muscles that are responsible for flexion and extension of the knee become stiff, leading to restricted range of motion. Since ACL is a condition that affects the muscles in the knees, the interventions suitable to be used are neuromuscular electrical stimulation, or known as NMES, which is then followed by strengthening exercise in order to get effective results. NMES is a tool used to initiate the contraction of muscles involved. In this case are the quadriceps femoris and the hamstrings, all responsible with flexion and extension of the knees. These muscles will have limited movement post-surgery, possibly causing muscle atrophy. NMES works by allowing the current passing through the electrodes that are placed over those muscles, and result will contract those muscles and either flex or extend the knees. Strengthening exercise is generally any physical activities done that requires the person to make their muscles work harder than usual. ACL will result in an unstable joint since the ligament's function is to stabilize the knee joint. Applying strengthening exercise will increase muscle strength, thus giving the knees its stability. Examples of the strengthening exercise suitable to do are the heel slides, wall slides, squat, and others.
Hello, so for today we are going to do neuromuscular electrical stimulation and heel slide exercise for patients with post-ACL surgery. So the purpose of neuromuscular electrical stimulation is to stimulate weak muscles. As we know that ACL patient has difficulty to engage muscle contraction due to muscle weakness after surgery, so NMES will help to execute voluntary muscle contraction. And then about the article that we read, it is most effective to use NMES combined with strengthening exercise. Okay, so here is our patient, NGA. He is a post-ACL surgery patient. So we are going to do the neuromuscular electrical stimulation and also heel slide activities as our strengthening exercise. So NGA, so next slide. Dalam minggu lepas ACL surgery? Okay, anyway. So hari ni kita akan buat neuromuscular electrical stimulation. So basically kita nak adakan muscle contraction dekat bahagian flexion dan extension sebab sebab dah disebabkan oleh ACL injury tu kan, jadi semasa ada limited range of motion. So kita akan execute voluntary muscle contraction tu menggunakan NMES. So macam tak kita punya initiate that muscle sendiri. So kita gunakan electrical stimulation untuk buat muscle contraction. And then after kita buat NMES, kita akan proceed dengan heel slide exercise. So basically this exercise akan bantu juga lah untuk improve range of motion, basically flexion and extension. Okay, so kita dah bermula. Okay, thank you.
The therapist will place the electrodes on the muscles involved in the flexion and extension of the knees. For knee extension, the electrodes is pasted on the quadriceps femoris while the patient is sitting at the edge of the bed with the legs hanging. After the therapist put in the program, they will need to select the frequency. In this case, the patient needed 18 Hz in order to show knee extension. The patient will need to repeat the knee extension for 12 times and carry out 2 sets.
And so we move on to the next, which is we will do knee flexion.
For the knee flexion, the patient will be in pronate position and the electrodes will be placed on the hamstrings. The frequency needed for the patient to elicit knee flexion was 20 Hz. The same repetition is applied here. Then after finishing with NMES, it is recommended to follow this intervention with strengthening exercise for better outcome. After ACL injury, it is crucial to restore back and maintain the range of motion in the knees. Knee extension is obtained by heel prop exercise and knee flexion is obtained by a heel slide exercise. Strengthening exercise can help to accomplish the goals to restore full knee flexion and extension after surgery or injury. There have been studies conducted regarding the application of NMES to patients with ACL injuries. In a study published in 2018, Hager et al. Examined the efficacy of NMES in addition to physical therapy in enhancing quadriceps strength after ACL repair. Based on the systematic review paper, we chose the 3 best articles as evidence-based. The first article by Taradash et al. In 2013 shows that NMES is useful for strengthening the quadricep muscles. Next, a study in 2011 by Hasegawa et al. The results showed that muscle thickness of vastus lateralis and calf increased significantly 4 weeks after surgery after using NMES. Lastly, a study by Michael Ross found that the ACL reconstructed lower limb in combination of strengthening exercise and NMES group performed significantly better than at strengthening exercise alone. In summation, NMES is recommended as one of the interventions used to get effective results to restore the range of motion of the knees, and this may be followed by strengthening exercise, which had been proven in a few studies. So that's all from us. Thank you for your attention.